we're always looking to advance the state-of-the-art in upper limb prosthetics, and more specifically the controllability of artificial limbs. So they range from very fundamental to very applied types of projects. Other big things relate to mobility and biomechanics. So our biomechanics research group has developed devices that help to assess limb strength and muscle spasticity. And we're actually taking that expertise into collaborative research with companies that are making assistive devices as well. Partnerships are an absolutely crucial part of the way that we can conduct our research and the scope of what we do. Stan Cassidy has been, and even more so than ever now, a very essential partner of ours, gaining access to the medical expertise and engagement with the patients at Stan Cassidy. We've partnered with companies, we've partnered with other rehabilitation hospitals in Canada and the United States. It's the part of research that not only does it make it fun, but it also allows you to extend the scope of what you can do, especially in a small place like Fredericton.
The medical research that we're involved with here at the Stan Cassidy Centre tend to involve what we call clinical trials with persons who have been affected by either an injury or a disease. We spend a lot of time working on mobility issues, so working with patients to try and improve their mobility, and whether that's impacted by spasticity or by pain. So we've been quite involved with a number of drug trials, testing new drugs to improve patients' ability to walk and patients' ability to move, to treat their pain and to treat their spasticity. Another area that's really quite exciting is in new technologies and taking new developments for pieces of equipment that can help improve a person's day-to-day function and improve their walking or their ability to mobilize. And so we've been working with key partners at the Institute for Biomedical Engineering in testing and developing new devices that are meant to be able to help people improve their ability to function and to move after they've had an injury or a bad disease. It's absolutely critical when you're doing research is that you're engaged with the people who eventually this research is hoping to help. And by that I mean we need to have patient engagement. Individuals who've been affected by a devastating trauma such as a spinal cord injury or a disease like ALS, Lou Gehrig's disease, or multiple sclerosis need to have some degree of hope. And hope comes from finding new treatments that are going to improve their lives, working towards better function and possibly cures. Being able to partner with groups like Ability New Brunswick has allowed us to really engage patients and consumers affected by these diseases and make them part of the research process. As well, it's allowed them to have better access to what is going on, not just at the Stan Cassidy, but nationally and internationally in trials. It's allowed us to reach out and get their inputs into research priorities and directions. Also having our key partnerships with the University of New Brunswick and the Institute for Biomedical Engineering, we cover the entire range now from basic sciences and applied technologies through to clinical care, right through to the community and patient or person engagement with the outcomes of that research. And that type of network of all those collaborators is essential, it's critical, and it's very effective for doing meaningful research.
We really have a best practice in New Brunswick when it comes to research. With a community organization like Ability New Brunswick, the University of New Brunswick, and the Stan Cassidy Centre for Rehabilitation, it's a unique collaborative effort that ultimately is looking to improve the health and quality of life of people with a mobility disability in New Brunswick. Some of the things a nonprofit organization, a community-based organization like Ability NB can offer in research partnerships is helping recruit people for research. It's also helping get the information out there about research studies and including the end result of research studies. We have significant membership of people with a mobility disability who want to learn more and want to know what's happening in our province. Ability New Brunswick engages in community-based research. We're often looking at issues that extend beyond the Rehabilitation Centre to home and community. We're often looking at quality of life issues such as access to health services or access to social programs or access to employment and education. It's really exciting for Ability New Brunswick as a community-based organization to be a valued and active member of this research partnership with the Stan Cassidy Centre and the University of New Brunswick.